Can a fall accelerate dementia? Understanding the link. This video is for informational purposes only and should not be used in place of the advice of a medical professional. In this video, we will explore how falls might accelerate dementia, examining the underlying mechanisms, the latest research findings, and strategies to mitigate these risks. Falls are a common and often devastating occurrence among the elderly. Beyond the immediate physical injuries, the impact of a fall can extend far deeper, potentially influencing cognitive health. Recent studies suggest that when a person with dementia experiences a fall, it can indeed accelerate the progression of their condition. The link between falls and cognitive decline. The physical injuries sustained during a fall, such as fractures or head injuries, can lead to increased confusion and decreased mobility. Any resulting traumatic brain injury, or even a mild TBI, traumatic brain injury, can lead to brain damage that compounds the effects of dementia and possibly spur the progression into later stages. Falls may also result in high blood pressure due to the stress they impose on the body, which can further affect blood vessels in the brain and promote the progression of cognitive changes. Risk factors for falls in dementia patients. Falls among the elderly are influenced by various factors, including environmental conditions, health-related issues, and physiological changes. Understanding these risk factors can help you implement preventive measures to reduce the likelihood of falls. Dementia severity and falling. The severity of dementia greatly influences fall risk. Early-stage dementia may show minor balance issues and occasional falls. As dementia progresses, the risk of falling increases dramatically. Severe dementia often leads to worse balance and coordination. Changes in gait and mobility are more pronounced in later stages, making falls almost inevitable. Environmental and demographic influences. Certain environmental conditions can increase the risk of falls. Poor lighting, cluttered living spaces, and slippery floors are common hazards. Older adults living alone might face greater risks due to the lack of immediate assistance in case of an emergency. Demographic factors also play a role. Age is a significant risk factor. The older you are, the higher your risk of falling. Women are generally at a higher risk due to conditions like osteoporosis, which weakens bones and increases fall-related injuries. Health conditions and medications. Various health conditions and the medications used to treat them can increase the risk of falls. Medications that cause dizziness or confusion, like sedatives, antidepressants, and some blood pressure drugs, can impair your ability to navigate safely. Comorbidities, or the presence of more than one health condition, can complicate treatment and increase physical frailty, making falls more likely. Physiological changes and age-related risks. As you age, changes in your body such as reduced muscle strength, decreased bone density, and poorer vision can elevate your fall risk. Muscle weakness makes it harder to maintain balance, while vision problems can cause you to miss obstacles or misjudge distances. Age-related changes also affect your balance and coordination. Slower reflexes and reduced sensation in your feet can make it more challenging to respond quickly to a loss of balance, increasing the likelihood of a fall. Preventing falls in those with dementia. Clinical interventions. Healthcare providers should assess fall risk factors such as high blood pressure and review medications that may affect balance or cognitive function. Regular cognitive testing and physical activity, with an emphasis on an exercise program that improves strength and balance, are key to maintaining health. Home and environmental alterations. Adjusting your home environment can significantly lower fall risks. Ensure good lighting throughout your home, especially in hallways, staircases, and bathrooms. Use night lights to illuminate paths at night. Keep pathways clear of clutter, loose rugs, and electrical cords. Secure rugs with non-slip pads. Install grab bars in bathrooms next to the toilet and inside the shower or bathtub. Use non-slip mats in the bathtub or shower to prevent slipping. Rearrange furniture to create wider walking paths. Ensure that frequently used items are easy to reach without using a step stool. Wear well-fitting, non-slip footwear indoors to prevent slips. Medical management after a fall. When an older adult experiences a fall, prompt medical management is crucial to mitigate potential complications, such as worsening of cognitive decline or trauma like hip fractures. Immediate response and assessment. After a fall, your immediate response should include an emergency assessment to identify acute care needs, such as addressing a potential hip fracture or head injury. Healthcare providers should conduct cognitive testing if there is any indication of memory loss or a sudden change in cognitive function, which are early symptoms of dementia. Rehabilitation and recovery. Following the initial response, long-term care planning is key for dementia patients who have experienced a fall. Rehabilitation is vital after a fall. Engaging in physiotherapy can help regain strength and improve functional status. Psychosocial support and family involvement. Post-fall care is not just about physical health. Implement supportive measures to address anxiety and depression that might arise after a fall. Social services can provide resources for counseling and mental health support. The role of healthcare providers. Healthcare providers play a crucial role in both the prevention and management of complications stemming from falls in older individuals, particularly those with dementia. An interdisciplinary approach involving various healthcare professionals is often necessary to adequately address the multifaceted nature of fall prevention and care in this vulnerable population. General practitioners and specialists. General practitioners, GPs, are often the first point of contact for you or your family members when concerns about memory loss or early symptoms of dementia arise. Specialists, such as neurologists, look into specific symptoms associated with various types of dementia, such as early-stage Alzheimer's or Lewy body dementia. They may order cognitive testing or imaging studies to evaluate brain health and the extent of any brain damage, which can clarify the underlying cause of the cognitive changes. Role of physiotherapists and occupational therapists. Physiotherapists help in strengthening muscles and improving balance, which can reduce the risk of falls. They can create personalized exercise programs for you, focusing on physical health. Occupational therapists work to modify your home environment to make it safer. They might recommend installing handrails or adjusting furniture to prevent accidents. These professionals also teach strategies for daily activities, helping you maintain independence. Navigating social services and support systems. Access to social services and support systems is essential for managing dementia and fall risks. GPs and social workers can guide you through available resources. They help in linking you with community programs and other support systems. Social workers can assist with accessing transportation services, meal delivery, and home care. They also provide emotional and psychological support, addressing factors like depression that increase fall risks. Effects on quality of life. Falls in older adults with dementia have a profound impact on quality of life. A fall can lead to a traumatic brain injury, which may exacerbate cognitive decline and precipitate a sudden change in your ability to perform daily living activities. Depression and anxiety can stem from the loss of independence and the fear of falling again, contributing to a cycle that may lead to further falls. Research and insights on falls and dementia. Exploring how falls may influence the progression of dementia is a subject of increasing interest among researchers. Researchers have examined how falls can impact dementia progression and identified various risk factors. Studies highlight the importance of fall prevention in managing cognitive impairment. Systematic reviews and prospective studies. Systematic reviews show that older adults with cognitive impairment are more likely to experience falls than those without it. People with dementia fall 2 to 3 times more frequently than their cognitively healthy peers, leading to serious consequences. These findings underscore the need for prevention strategies tailored to those with cognitive decline. Prospective studies confirm that falls can accelerate dementia by causing physical decline and limited mobility. When you become bedridden after a fall, dementia's symptoms often worsen. Conclusion: understanding the link between falls and accelerated dementia is crucial for safeguarding the cognitive health of our elderly loved ones. By recognizing the risks and implementing preventive measures, we can help reduce the likelihood of falls and their potential impact on dementia progression. Awareness, early intervention, and supportive environments are key to ensuring that falls do not contribute to a faster decline in cognitive abilities. By staying informed and proactive, we can create a safer, more supportive world for those at risk. Thank you for watching. To read the full article, go to livingyourSeniorLife.com. The link can be found in the video description.